RFA and the study's pretty good. And I don't think I need to tell this group particularly that the burden of disease we know from air pollution is primarily due to chronic exposure. But we do know that challenges exist in measuring and modeling long-term exposure to air pollution, right? And especially for air pollutants that perhaps don't have regulatory networks backing them up yet, but these are emerging pollutants of concern. Things like ultrafine particles, black carbon, certainly NO2 is one we measure at fixed sites, but we know that there are very high spatial and temporal gradients associated with many of these pollutants, which makes it more difficult to predict an individual's long-term exposure to these pollutants. With that comes the understanding that if we can't measure pollution exposure well, we're not going to be able to model or manage it in the long term and understand its drivers of disease. So that's, really a problem, especially if we want to be conducting causal epidemiologic research. This RFA came out in 2019, and so at that time, there were emergent techniques coming out, such as mobile monitoring, low-cost sensors. We've heard a lot about these things this week, machine learning, that showed promise for improving the state of the art in assessing long-term exposure to air pollution. That led to this RFA, 19.1, applying novel approaches to improve long-term assessment of outdoor air pollution for health studies. So I'll quickly review the objectives of this RFA, and I've kind of highlighted some key terms here to remind myself what to focus on. This RFA specifically wanted to focus on long-term, so we're talking months to years of exposure prediction to outdoor air pollution. Obviously, indoor air pollution, especially since 2020, has become an interesting topic, but this RFA wanted to specifically focus on exposure to outdoor air pollution. It could mean outdoor air pollution coming indoors, but pollution of outdoor source. Wanted to focus on pollutants with high spatial and temporal variability. And of course, the RFA encouraged the use, it didn't prescribe, but encouraged the use of novel techniques that I've mentioned, like sensors, mobile monitoring, location tracking, machine learning. In addition to improving exposure techniques, the RFA wanted investigators to quantify exposure measurement error relevant to health research, and to explore how that measurement error might affect health effect estimates in epidemiologic contexts. So as I mentioned, the RFA was opened in 2019. 5 applications were ultimately awarded. I do want to note that these applications began in 2020. If we all think back to 2020, it was an interesting year. In addition to having to wash their groceries on a daily basis, the investigators had to deal with the pandemic for how they implemented their studies, which was, of course, very challenging. And yet, all were successful in their objectives, which is remarkable. So today we'll hear from our 5 investigators, Leanne Shepard, Scott Weichenthal, these are the PIs, Clea Katsiani, Gerard Hoek, and Kees de Hoek. I won't read the titles of their talks, but I will give you a little bit of an idea of the diversity of these studies that were funded. So here's a quick table of those 5 investigators. You can look at the diversity of locations all over the US, Europe, and Canada. Sample sizes for many of these varied from thousands to millions of subjects. And as you'd expect, a lot of the pollutants have these high spatial and temporal gradients like ultrafine particles, NO2. PM2.5 was largely included in many of these studies because it could be done. And then you look at the sort of monitoring data that were available for these studies. It ranges from personal to outdoor, ambient, and many sorts of exposure assessment methods were employed for these studies. And so we'll hear from these investigators today on these studies. So that concludes my introduction. We'll now move to Dr. Leanne Shepard. Leanne is the Rahm and Haas Endowed Professor in Public Health Sciences. She's professor and interim chair of Environmental and Occupational Health Sciences and a professor of biostatistics at the University of Washington. Her research interests focus on exposure assessment for study design, exposure modeling, and inference about the health effects of environmental and occupational exposures. Recently, until very recently, she was chair of the Chartered Clean Air Scientific Advisory Committee for EPA. Please join me in welcoming Leanne.
Thank you, John, and thank you, everyone. It's a pleasure to be here today. I'm packed a lot into 10 minutes, so we'll see if I can get through it. So I'm going to start with telling you my research questions, and then I'm going to spend a little time focusing on the design and the approach. One of the things, our report covers quite a bit of ground, but I'm going to focus pretty much exclusively on our mobile monitoring study and the stationary data that we collected in that. The results I'll talk about include exposure model performance, health inference, measurement error, and cost and performance. So my research questions that I'm going to talk about today are: how does mobile monitoring design impact exposure model performance and health inference? Is exposure measurement error more important than design? And what are the cost and design trade-offs? So first, I want to give you a bit of an introduction to our mobile monitoring study in Seattle. It was quite an extensive study that we drove around the city over 285 days between March of 2019 and March of 2020. You see in the map, you see the routes that we drove, and the dots are where we stopped. There were 309 stationary locations, and we visited each of those an average of 29 times. We drove on all seasons, all days of the week, and most hours of the day. So we took the data, which were 2-minute averages, and we distilled those down to the median at the 2-minute level. And then over the 29 visits, we winterized those, which means we recoded the values above the 95th and the below the 5th percentile to that level. And then we averaged those to get an annual average. And then we modeled those. We used universal kriging with partial least squares to distill about 200 covariates. And the map that I just showed turned on shows you the distribution of ultrafine particles in our mobile monitoring area. And the highest is around the airport and in the port area and in the city center. So then we coupled that with the adult changes in thought cohort study, which is a longstanding cohort that started in 1994 in the greater Seattle area and is focused on elderly people who were in the community. And we looked at our model was a linear regression model, cross-sectional model at baseline. Our outcome was CASI-IRT. CASI is a measure of cognitive function, and the item response theory transforms that to be more informative at the higher cognitive function levels. Our exposure was predicted ultrafine particles over a 5-year residential history average prior to baseline. Our parameter of interest was our beta estimate, which was the association with ultrafine particle exposure. And our covariates in our primary model that I'm going to talk about today were age, year, sex, and educational attainment. And then we also had an extended analysis that added race and SES, measure of SES. So I'm going to talk about what we did to understand design. We had our all data Seattle campaign, which is our reference design that I already described to you. And then from that, we took random samples of our visits, and we used that to come up with a number of different reduced sampling mobile monitoring designs. And then we developed an exposure prediction model for ultrafine particles from each of those. And then we connected that with health inferences. And we repeated those 30 times. So each time was like a campaign. You could think of that as one realized campaign, and we looked at 30 of them for each design. So here are our exposure model performance results. These are exposure model R-squareds, and the top dashed line is our all data reference model. And the first set of box plots is the fewer visits design, where you see that the 12 visits performs almost as well as our 29. Our next, so that's similar to the reference. Our next one, we restricted to 12 minutes, and we looked at 12 visits, and we looked at fewer seasons, and all 4 seasons performed similarly to the reference design. When we looked at fewer days and hours, specifically the traditional business and rush hour designs that are often used in mobile monitoring studies, we saw quite a bit of drop off in performance. And we also tried to temporally adjust our data to get back to as though we had sampled all hours of the day, and we didn't find that that improved our exposure model performance. We had a very balanced design, and so we also looked at other ways of doing unbalanced, and we found that that the balanced design performed the best. And if we preferentially undersampled high exposure location, that was the worst. And so the conclusion is the reduced exposure model performance is with more restricted performance monitoring designs. So the next result is the health inference result. And what you see first is the no association line. And the reference is the all data exposure model. And the shading is the 95% confidence interval for that. And the box plots are the point estimates for the various designs. You see that we got mostly similar health inference estimates when we had fewer visits and fewer seasons. However, we got very attenuated health effect estimates when we looked at the fewer hours designs. Our extended adjusted model, which incorporated SES and race, we didn't find an association and we didn't see much difference between the designs. Now, exposure measurement area, this is a pretty sophisticated work, but I'm going through it super fast. Typically, we collect exposure data at monitoring locations, and we have health outcome data where the individuals live. We fit an exposure prediction model at the cohort locate and predicted the cohort locations. This leads to two different kinds of measurement error. Classical like measurement error, which is due to the finite exposure data. We just don't have an infinite amount of exposure data, so it's noisier. And then Bergson like measurement error that has to do with modeling, so the smoothing that you do. And so when you do the health inference and you link the predicted exposure to the outcome, then you can end up with biased and more variable health estimates. So now I'm going to show you our results. This is our measurement error corrected result. And you see the point estimate and the 95th confidence interval. And in comparison, the uncorrected result looks very similar. There was about a 6% change in the estimate and about a 13% wider confidence interval with the measurement error correction. If we look at the design without measurement error correction, you see the reduced monitoring with 12 visits gets a little bit of attenuation, about average 5%, but the business hours monitoring, in contrast, we have about a 60% attenuation. So the design had a much bigger impact in our results, at least the poorest performing design, than measurement error correction did. Finally, we did a little bit of cost and performance evaluation. And so we considered fixed costs. And what we're plotting here is the variable costs that we characterize as number of working days. And that's shown in red on the plots that are, and in blue is the model performance as exposure model R squared. And you see that, as you would expect, both cost and performance improve as you have more sites and more visits. However, the relationship is not as increasing as rapidly for performance as it is for costs. And in particular, we identified that about 12 visits was a pretty optimal number of visits in our data set. When we further looked at monitoring beyond looking at other popular designs, reducing the number of seasons or reducing the hours of the day, we found that while the cost was relatively unimpacted for 12 visits, the performance varied quite a bit. So separate from logistical constraints, which could increase costs, and our paper we published on this does address that. It's better to have a really good design and as opposed to a more logistically feasible design in terms of cost performance trade-off. So that's it. For me, in conclusion, spatially and temporally balanced mobile monitoring, improved exposure prediction. The health inferences were most sensitive to business and rush hours, but were minimally impacted by other sampling restrictions. That we found minimal improvements from exposure adjustments, which is quite popular in the literature. We found the design impact was much more important than the exposure measurement impact. And finally, we found optimal costs and performance with 12 visits per site and monitoring beyond business and rush hours. So that's it. And I want to thank my study team. It was a large team, and for HEI for funding this study. It was a lot of fun, and I really appreciate the opportunity to work on this.
Thank you, Leanne. Our next speaker is from the Weikenthal group. It's Marshall Lloyd. Let's see if we can bring Marshall online. Hi, Marshall. Can you hear me?
I can. Can you hear me?
You're coming through great. I'm going to introduce you quick, and then I'll turn the slides over to you.
Great, thanks.
So Marshall Lloyd's a research associate with the Weikenthal Research Group at McGill University. His research focuses on environmental risk factors for chronic disease and mortality, and he's particularly interested in modeling variations in environmental exposures to things like ultrafine particles and pollen. Marshall, thanks for being with us. Take it away.
My pleasure. And yeah, I also really appreciate the exceptional accommodation for me giving this remotely. I know it's better in person, but yeah, I really appreciate it. Yeah, like you said, I'm at McGill with Scott Weikenthal, and this presentation will mostly focus on the deep learning that we incorporated into the study. So this is the HEI project, like you described. So briefly, we did mobile monitoring in Montreal and Toronto. It was a year-long campaign. Then we developed some land use regression models where land use parameters are the predictors. But then we also developed deep learning convolutional neural network models. So I'll just call those CNN models or deep learning models. And that's where the predictors are satellite images, digital images. And we can combine those two models, develop some prediction surfaces. Those prediction surfaces are estimated long-term exposures of outdoor ultrafine particles for our cohort. So we linked that to the cohort and then estimated associations with mortality. If you really want to dig in, you can go into the report, but I'll just focus on some of the lessons learned. So data collection, much less sophisticated analysis than Leanne's. I think she hammered this home quite convincingly, but we also found, like we monitored on evenings and weekends. And I did some of the monitoring, and yeah, it's less convenient, but it's definitely worth it. There was mobile monitoring campaigns in Montreal and Toronto back in 2011, 2012, and those campaigns were only weekday rush hours, which is not representative of annual averages. And as you can see here in the table, those the median concentrations during those periods were much higher than what we did when we balanced it. SARS was a year-long, evenings and weekends, and so just much less sophisticated than Leanne's analysis, but strong agreement. Another element, trying to account for long-term trends in outdoor UFPs. So monitoring and modeling conducted in 2028 and 2021, but our cohort, we followed up starting in 2001. So, we make the assumption that the spatial contrasts are conserved over time. High pollution areas are the same in 2020 as they were in 2001, but that's, I don't know, a pretty strong assumption. As a sensitivity analysis, we also used historical traffic data. We had traffic intensity and emission factors for NOx all the way back to 2000. And so in our land use regression model, we used those values to kind of backcast our UFP predictions into the past. We didn't have any historical UFP measurements to validate this method. So it's not faith-based, but it's, we didn't have any data to see if it was effective. In the epi analysis, there was hardly any impact on the hazard ratios. So, one interpretation is that maybe our main analysis assumption was rock solid, but I think more likely is that this method just was limited and we didn't really successfully backcast. And this all just kind of speaks to the lack of long-term UFP monitoring data. Would have loved if we had, one or two sites. Even that would have been wonderful, but we had nothing. So just really not enough long-term UFP monitoring data out there.
Marshall, can I interrupt real quickly? I just want to make sure
Sure.
if you are going to share slides, we haven't seen them yet.
Oh, shoot. Oh my goodness. Okay. Um, how about now? Oh, you've just been seeing my face the whole time. Okay.
Yeah. No,
Okay.
it was great. You're a very
All right.
engaging speaker.
Oh, well, thank you. A lot of hand gestures. So, I mean, here are those numbers I was talking to. High numbers during weekday rush hours, low numbers if it's more representative of annual averages, and the rest has all just been text. So, I thank you very much for catching me because now we'll get into probably hopefully some better figures. Um, so yeah, this is kind of the heart of this presentation, talking about our experience with CNNs. Just briefly, like a digital image is just an array of numbers, right? Representing the different intensities of colors, so of all the little pixels. So you take those digital images and you link them to the air pollution that was measured, like in this case, outdoor UFPs at the center of that digital image. And then the machine learning algorithm, through a bunch of iterations and trying to minimize the loss score, will learn features of the image that are associated with elevated UFP concentrations, or the labels in this case. Um, so in general, in our case, our land use regression models performed better than the CNNs. You can see here in green means good. LURs were, better. The CNNs did pretty well, okay. They're pretty good. I think in large part the LURs did so well because we had like really extensive, curated, validated databases of land use data, which is like a luxury, and that makes modeling with a land use regression model much easier. In a different application, when we did sort of the same method in a rapidly urbanizing city in South America, that was a much more data sparse environment, is what I kind of like to think of it as. Like they didn't really have extensive land use data. Not too sure what are industrial areas, like a lot more informal economy. And in that case, the LURs struggled. It was like a lot harder to develop an LUR model. And in that case, the CNNs were much more useful. So in our Montreal and Toronto areas, the CNNs, yeah, I think they're useful, but it's in data sparse environments. I think that's where CNNs can be particularly useful when you don't have much land use data. Just, I guess, qualitatively, you can look at these two surfaces. This is of Toronto, UFPs, outdoor UFP concentrations. You can see the land use regression model has a smoother surface. That's because it's capturing a lot of the spatial dependencies. We were, any good statistician will tell you that spatial data needs to be treated as such. And so the LURs were able to capture that, and that's part of the smoothing you see there. Whereas the CNN is just limited to the image and didn't capture spatial dependencies. Another way to think of that is this image might be a little headache inducing at first, but if you bear with me, I'll walk you through it. So each one of those little squares is an actual image that we use to generate a prediction. And so that's why it kind of looks like a bit of a tapestry. And within each of those images, we have a circle, that's the CNN prediction. And then in that circle, we have an asterisk or a star, that's the LUR prediction. So when they both agree, like you can see in this residential area up north and kind of the trees and forest there, the CNN and LUR agree, so it kind of just looks like a circle because both are green. And then as you move south, you see this gray area, more industrial. I think that's like a Amazon fulfillment center. You can see the circles turn red very quickly. So that's the CNN prediction jumping quite a bit over a short distance. So up in the residential area, in the forested area, low predictions, and then all of a sudden you go a couple hundred meters and the CNN is now predicting very high levels of UFPs. But you can see now, you notice the asterisk or the star within the dot, that's the LUR prediction, increasing, but not as rapidly as the CNN. So that's kind of like contrasting the sharp gradient versus a smoother gradient. We don't have actual measurement data in there, so I can't tell you which one's right. It's just qualitatively saying that the CNN has sharper gradients. Another thing you might catch is in the right-hand corner, or like upper northeast of this, in the green area, that's actually the zoo. And there's a couple red dots unexpectedly. And unless, like the zoo animals are operating chainsaws and lawnmowers, that doesn't really pass the eyeball test. And that was something we found with the CNNs, that sometimes in these green spaces, they would generate predictions that were unexpectedly high. Now, no one in the cohort had residential addresses in these green spaces, so it didn't impact the epidemiological analysis, but it's just kind of curious behavior. And here you can see on the left side, these are images that were captured probably during a drier period where just the sports fields are being irrigated. And you can see the associated prediction is pretty high, like the lower left one here. That's predicting 20,000 in the middle of a sports field. And my guess is that it's these kind of long straight edges that kind of look similar to long straight edges that are used to like infrastructure such as roads. The year later, we went and downloaded the images again, and it was during a more lush period when there's probably had been a lot more rain. You don't see those long straight edges of dry grass, and now the CNN predictions go back down. So this kind of speaks to the the black boxness of CNNs, or any machine learning algorithm that can make people feel a little uncomfortable because you can't really explain this behavior. One approach we took to kind of build a bit more trust is to see if the models would behave in a way that we would expect. So on the left here, you see an original image. That's a residential area, some trees, houses, predicting UFPs at 10,000. Then in the middle, this is another, this is a real area in Toronto where there's a bunch of highways and the prediction is 35,000. So that's pretty high. Now, the image on the right, that's us photoshopping roads into the residential area. So you can think, okay, what if we slapped a big highway into that residential area? This image on the right is not a real place. It's imagined. It's just photoshopped. But what would happen if we slapped a big highway in the middle of a residential area? Well, we would expect the prediction to go up, and lo and behold, the model behavior met our expectations. Now, this is not a home run, but it helps kind of build trust in the model that is doing things that we would expect. So, should you use an LUR or a CNN? If you have a lot of monitoring sites, then you can consider using a CNN. If you have less than 1,000, you probably can't even train one. If you have digital imagery for the entire area, that could be useful. If you want to manage that digital imagery, that it's even if you have free images, it's a hassle, it's time, it's money, it's your time and energy to manage. If you think the information in the images is relevant to the variations of the target pollutants, so you can't really use satellite images for like hourly variations in the UFPs. You have to kind of think about what's plausible. If you have limited land use data, that's really I think where CNNs are most useful because you can't make as good of a land use regression model typically. And then you have GPUs. Otherwise, LUR models are very useful and possibly perform better than the CNNs. Yeah, this is just repeating what I said. And yeah, acknowledge, really appreciate the HEI funding. Huge team collecting tons of data. It was really, really fun. Very, very interesting project.
Thanks, Marshall. If you can hear me, stick around for our Q&A session. That'll be in a few minutes.
Absolutely, for sure. Thank you.
Yeah, great. So I'd like to invite our next speaker up, Dimitris Evangelopoulos. Dimitris is a research fellow in environmental epidemiology and the Environmental Research Group at Imperial College London. His research interests include epidemiology, biostatistics, measurement error theory, and health impact assessment. He focuses on the health effects of air pollution, extreme temperature, and other environmental stressors. He's an associate member of the UK Committee on the Medical Effects of Air Pollutants and has also acted as an external advisor for the WHO.
Thank you, John. And good afternoon, everyone. I'm Dimitris, and I'm going to talk to you about measurement error and what is true personal exposure. So it might be a bit of a philosophical discussion in the end of what we consider as true personal exposure or true exposure to outdoor air pollution. And I'm going to focus mainly on the results that we had in our study called MELONS. MELONS is an acronym for this bigger title, investigating the consequences of measurement error of gradually more sophisticated long-term personal exposure models in assessing health effects. And it was a really nice collaboration between multiple people. We had colleagues from Imperial and St. George's. Claire Katsuyani was leading these projects. She couldn't make it, so I'm giving this presentation on behalf of her. So from the UK, we had Imperial College London and St. George's. We had Evi Samoli from University of Athens, Greece, and also Joel Schwartz was involved from the US. Now, to give you a little bit of a background, we know with quite some confidence right now that when we use a surrogate exposure assessment methods, this introduces bias in our health effect estimation due to measurement error, and these biases are usually towards the null. And you already saw from the first presentation that these biases can be quite low. I think Lian found 6% bias in her health effect estimates, but other studies have found much higher biases. And the magnitude of the bias is mainly based on the definition of what we assume as true personal exposure and what our surrogate replaces actually when we talk about true personal exposure to air pollution. So what we did, we had our own suggestion for what we think is true exposure to air pollution. And our overall aim was to answer this question: are increasingly detailed estimates of long-term individual exposure to air pollution useful and effective in having better health effect estimates, and especially in large-scale epi-studies? And we heard about that from Perry Heisted yesterday, who was talking about long-term personal exposures as well. So what we did, we said, okay, we have some personal exposure measurement campaigns already that has been we utilized previous personal exposure measurement campaigns. In total, we had 13,000 person days of personal exposure measurements in London from different populations. So we had COPD patients, school children, professional drivers, and healthy adults. And our flagship was the first study, COPE, which is, I think, Ben Barrett is the PI, and we still say that it's the longest personal exposure measurement campaign in COPD patients. We had personal data for up to 6 months. And this is like just a map of where these people live. So as you can see, if you combine all these black dots together, you will see that we had a nice distribution across London. And also in London, we have a quite dense monitoring network. So the green dots are where the reference monitors from the monitoring network are. So as you can see, we have quite a few there. So we had 4 main work packages trying to address 4 different research questions, but very much interrelated. The first one was to develop these long-term estimates of personal exposure to outdoor air pollution, which in our case, we assumed it is the true exposure to pollution. It's what people actually breathe. So we took that information from these previous campaigns. We combined the measurements, the GPS data. We applied some exposure separation techniques into indoor and outdoor sources, and also a behavior prediction algorithm to predict annual levels, because usually that's what we use in cohort studies of estimating effects of long-term exposures. And what we found is that even for those people that spend most of their time indoors, like COPD patients, 93% of their time indoors, they're still exposed to high levels of their personal exposure, is coming from ambient levels is quite high. So 49% and 41% of total personal exposure came from outdoor sources for NO2 and PM2.5 respectively. And this is a graph. It's based on a recent publication from our colleague Hanbin Zhang. And I have this graph here to show you that for some people, indoor sources are higher, the red curves, while for others, it's the outdoor sources that are higher, the bottom part of the graph. So what we learned from this application is that it's definitely not straightforward how you estimate personal exposure from other sources, and because it requires some assumptions, and I'll come back to that a bit later. We also found that people are exposed to both outdoor and indoor generated pollution, and even if they spend most of their time indoors, they're exposed to high levels of outdoor generated pollution. Now, work package 2, we had all these people with personal exposures, and we said, okay, let's link these personal exposures with all these surrogate methods, exposure assessment methods that are usually used in epidemiological analysis, and compare them. So we had estimates from the nearest monitor, we had estimates from spatiotemporal models with really good performance measures. From the STEAM project, which was based in London, and the Labs project, the data were kindly provided by Case. And we also had another model which was adjusting for typical time activity patterns with an indirect adjustment and providing estimates taking time activity into account by age and sex and where people live. What we found very briefly is that when you predict annual personal exposure from outdoor sources, this is very, very lower to what nearest monitors or spatiotemporal models give you. So there is a big difference in the magnitude. Of course, this does not mean that you will have bias in your health effect estimation. You can have a very high difference in the exposures, but the beta coefficients in a regression model can be very similar. It's just the intercept that is different. What we also found, though, is that they're very, very low correlated. So personal exposures were very low correlated with these surrogate methods, surrogate exposure assessment methods. So both for the nearest monitor and the model estimates, you can see from this table here that the highest correlation that we found was 20%. So what we learned from this work package is that we can quantify exposure measurement errors as differences between what you assume as true exposure and your surrogate methods. You can identify the error types. Liane talked about classical and Bergson error. And you can also explore what are the error determinants. So what are the characteristics that affect the errors, which is very, very important for study design. And we also found, as I said earlier, differences in the scale and very low correlations. Part of that work package was also, the aim actually was to inform a simulation analysis. And the inputs that we used for simulation analysis is correlation coefficients, variance ratios between surrogate and true exposures, and the percentage of classical and Bergson error in the mixture. So these were the inputs used in a simulation analysis to quantify biases in health effect estimation, which was our ultimate aim in the project. And based on the data that we had for this project, we found some really extreme scenarios of measurement error. As you can see, the variance ratios are far away from 1. 1 means practically no error, same variance between the surrogate exposure and the true exposure. And yeah, we had scenarios of even 165 ratios for NO2. So objective 3 was to quantify the measurement error bias using simulations. While we were working on the first 2 work packages, our colleagues developed a theoretical framework and tested some measurement error correction methods using some inputs from previous projects. This was the first set of simulations. Then we had simulations based on the inputs that I showed you in the previous slide. And then we also had another set of simulations using literature-based scenarios, which were far more moderate compared to what we found. Overall, the simulation framework was, we hypothesized a cohort of 10,000 people, simulated survival time. We used concentration response functions from the literature and incorporated measurement errors defined on these different scenarios that I just mentioned. Very briefly, for the first set of simulations, the theoretical ones, we showed that measurement error corrections do perform really well. So we had different scenarios with biases up to 27% when the right-hand side of this graph, when all the errors of classical type. And if you correct using correction methods like simulation, extrapolation, or regression calibration, you do have much better health effect estimates. The biases are much lower, as you can see from the greenish and the red one, the bars. Then, okay, we said, let's apply what we found from our previous work package and see what biases we get. And we were expecting that the biases will be much, much higher. And we found up to 91% and very low coverage probabilities because, as I said, our measurement error scenarios were quite extreme. And in the last set, where the scenarios which were much more moderate, we still found quite significant biases. Only the blue line is not so extreme, the bias is not so extreme, and sometimes can go away from the null, but this is very rare, and it's mainly for Bergson error types. But still, with relatively moderate error scenarios, you can see that the bias can range from 50 to almost 100%. And finally, what we did, we said, okay, we developed a theoretical framework for our measurement error correction methods. Let's apply them in a real cohort. So we used the UK Biobank cohort, restricted the analysis to London because we had validation data only for London. These personal exposure measurement campaigns were from London. So we had almost 61,000 individuals, and we assessed various health endpoints. Our main ones was natural cause mortality and COPD incidence, and assessed the impacts for NO2, PM2.5, and ozone, and how the health effect estimates change when you apply correction methods. So as you can see in this table, most of the associations were not significant. Only when we corrected for Cymex, we resulted in a significant association. But what is interesting is how bigger the effect estimates can be, both for natural cause mortality and COPD, when you apply a correction method. And the lesson learned is that it can be 2 or even 3 times higher if you apply a correction method. But these methods rely heavily on the presence of validation data. So we really, really need this kind of validation data. Now, to sum up, what is true exposure? Some people compare models with reference monitors, so they use the reference monitors as a true exposure. In our study, we hypothesized that personal exposure to outdoor-generated pollution is the gold, or in the end, we said it's the silver standard because of the assumptions that you have to make to estimate that. Outdoor-generated pollution, it is still an issue even for people that spend most of their time indoors. So for future studies, do we need to set standards for personal exposure campaigns used as validation data sets, especially for long-term effects for epidemiological studies, cohort studies? And if we do that, what we think we really need is personal measurements to be coupled with residential outdoor levels in order to estimate infiltration. And yeah, to conclude, we found that exposure measurement error can lead to large underestimation of health effect estimates, even when the errors are quite moderate. And the biases can be even higher in multi-pollutant models. And for policy, this is quite important because if you apply the health effect estimates that you find in EPI analysis in a health impact assessment, do you need to consider corrected concentration response functions or not? The corrected ones appear to be much higher than the uncorrected. And this means that the impacts can be much higher and can justify more ambitious policies. Yeah, thank you very much. And yeah, we also had a nice time. It was quite fun. Yeah, this is just some of the people involved. Yeah, thank you.
Thank you, Dimitris. Our next speaker would be Gerard Hoek from Utrecht, but Gerard unfortunately couldn't be here today. Fortunately for us, his collaborator on this project is Kees de Hoek, who is also his own PI of the 4th project. So we have Kees as a double speaker this afternoon for both talks. And he's very good at this, so we're pleased to have him. Kees is an environmental exposure scientist at the Swiss Tropical and Public Health Institute. His scientific research focuses on spatial modeling, exposure assessment, environment and health using very cutting-edge spatial and temporal models. He uses those models across satellite, fixed site, and mobile data. He's been involved in a number of large projects across Europe. Currently, the co-PI of the European Research Projects Expanse and UBD Policy. Please join me in welcoming Kees.
Well, thank you very much. Yes, so I stand in for Gerard, who couldn't make it, unfortunately. But as I was part of this study, I should be able to give you an oversight of what we found. So this is the first one, is about comparison of long-term air pollution exposure for mobile and routine monitoring low-cost sensors and dispersion models project. And this was a collaboration between IRAS, University of Utrecht, and the National Institute of Public Health and Environment, RIVM, in the Netherlands, and of course, Swiss Tropical Public Health Institute, where I am from. So the background of this study was to see, so epidemiological studies of long-term air pollution, they use different methods to assign exposure to outdoor air pollution. And these typically are land use regression models or dispersion models. And, the question, of course, is, does this lead to the differences in estimated health effects? So the objectives of this study, therefore, was to develop long-term ambient air pollution exposure estimates for selected epidemiological studies, and these were all in the Netherlands, based upon low-cost sensors, mobile and stationary monitoring, and deterministic dispersion modeling. And then we compared these different exposure assessment models and methods in terms of their ability to predict spatial variation of long-term average concentration. And we did that also on external validation data. And in the end, then we compared these different exposure methods in terms of their air pollution effect estimates in these 3 different epidemiological studies. Pollutants of interest, as already was said, is UFP, NO2, black carbon, and PM2.5. And in this presentation, I'll mainly focus on NO2 and black carbon. So this figure shows you a little bit how the study was set up. So in the middle, you see the different exposure models we used, and I'll show you a couple of examples throughout this presentation. And on the top left, you see the different modeling approaches. So we had the empirical ones. So these were the land use regression methods. And then we also had the deterministic dispersion models. So the empirical methods were using monitoring data, either mobile or stationary data. And then we compared these different exposure methods mainly on the 20,000 randomly selected addresses across Netherlands to have a look at the comparison. And then ultimately we use these exposure models to then assign exposures to these different exposure methods. So now go straight to some of the results. There's lots of results, so I just point you to the report if you want to see the full set of data. But here I just show you NO2 data compared over years. So I should also mention that we had data from 2010 to 2020. And this shows you, just as an example, data predicted from dispersion models across the Netherlands. And you see that really there's not that much difference between all these estimates. The correlation is very high, even from 2010 compared to 2019. So we really, found that there's high correlations between annual exposures, actually for most of the pollutants over a 10-year period. So we then also compared these NO2 estimates between models. And so you see one example of NO2 exposure estimates from supervised linear regression models, but also one dispersion models. And again, you see there is quite some high to moderately high correlation between the models. So again, not only over time, but also between methods, you see quite high correlations over these 20,000 randomly selected addresses in the Netherlands. But even though there's a high correlation, there's also some systematic differences between these exposures at the individual address level. And you see that in this Bland-Elman plot. So here we compare the dispersion model estimates with EXPANS, and EXPANS is a type of land use regression model for the same year. And you see there is some, agreement, but you also see that at the higher end of the estimates, there are quite some differences between these estimates. And here you see that, for example, dispersion modeling tends to underpredict compared to the land use regression model estimates. So we do see some systematic differences there. And then we also were able to validate these models with external validation sites. So here in this example, just show you NO2 estimates compared to 400 palm tubes measurement data for 2019. And again, you see, quite some good correlations between these estimates and this sort of external validation data. And so on the whole, generally, we saw no systematic differences between dispersion and land use regression models based on either mobile or fixed monitoring data. So that was sort of looking at the exposure data, and then we linked that, of course, to our epidemiological studies. And so here I just picked out, or we picked out black carbon as an example. And so this was now assigned to national cohort of the Netherlands with about 11 million data points. And we looked at natural mortality. And you see here that either for per 1 microgram per cube increment or per interquartile range increment, there were still, for all of these exposures, we saw a significant association. So on the, you see on the bottom right, there's all these different models we assigned to these 11 million people in the national cohort. But we also saw some differences between risk estimates. Although they were all significant, they ranged between 1.01 to 1.07. So there was some difference between that. And here we did the same thing. We assigned black carbon estimates to the Pyjama birth cohort. That's a much smaller cohort of about 4,000 children. Here we looked at asthma incidence. And again, you see, now I'm showing you on the top based on birth address and at the bottom the current address. We see there's not actually hardly any difference between those two. But you again see between the different models, you see quite some differences in risk estimates. But they're all significant again. So what we found is we found quite a large heterogeneity in effect estimates between all these different models. We saw no systematic differences between this dispersion model and empirical land use regression model estimates. And some of this heterogeneity was explained by the validity of the model and the predicted exposure contrast. But still, most of this heterogeneity was unexplained. We couldn't really explain very well. So what we also found that year of the model didn't really make a difference. So we could use any of the within that 10-year range. So that was consistent with the high correlation, of course, between the years we saw earlier. We saw mostly high correlation between exposures of different models. However, there were still large systematic differences in level found. But all methods showed these sort of positive associations with natural mortality and with ANSPA incidence. But again, estimated effect size differed substantially. So, final conclusions: no systematic difference between land use regression models, dispersion models, either based on mobile or fixed sites, validity and effect estimates, also in the epidemiological studies. We didn't really find a preference for a specific method. But what we do suggest is that if you do a study, it would be good to maybe, apply a few of these different methods just to show that you have this robustness in your findings. We definitely showed that, but I think that's sort of one of the suggestions coming out of our study. And by that, I thank you on behalf of Gerard Hoek, who was the PI on this project.
Thank you, Kees. And now we'll welcome you again to the stage for your own PI-led talk.
Yeah. Well, so here I am again. Thank you. So now I turn over to a slightly different template of slides. This is like from Swiss Tropical Public Health Institute, and I'm going to present now the study I was responsible for, but actually Gerard was also part of. So we had 2 projects on the go in this RFA. So this is really about accounting for mobility in long-term exposure estimates of air pollution. And does that really matter? That was sort of the question we set out. So why did we do this? Well, large-scale epidemiological studies investigating long-term health effects of air pollution, they typically ignore where people go, right? Ignore mobility. And of course, people are mobile. They're exposed to all sorts of different levels of air pollution, depending on what they do and where they are. And if you ignore that, this may lead to incorrect distributions of exposures, and that might lead to biased exposure health relations in epidemiological studies. So what did we do? We designed a study, and first thing we did was we developed a novel traffic-related air pollution exposure models, incorporating population dynamics using agent-based modeling. We then conducted tracking campaigns to evaluate these exposure models. And then we applied these exposure models to Swiss and Dutch population to study the long-term exposure to air pollution and health effects. So first, we did some exposure modeling, of course, to give us those NO2 and PM2.5 services, and we did that by weekdays and weekend days. And on the right, you see these diurnal patterns of NO2 and PM2.5, and you clearly see that weekends are different from weekdays. So that's why we did that distinction. In Switzerland, we were able to rescale annual average PM2.5 and NO2 services, and we did that based on measurements at background monitoring stations across Switzerland. And in the Netherlands, we actually developed totally new long-term NO2 and then hourly NO2 land use regression models based on hourly routine monitoring data. And on the bottom, you see one of our publications on that, and you see clearly these are just 4 hours of those 24 hours we modeled. You clearly see the differences in levels between those hours. So what we did with this exposures, we linked those to agent-based modeling estimates. And agent-based modeling, basically what it means is we divide our population into different profiles based on either whether people work or not, by age, by sex, and by socioeconomic class. And then we created activity schedules and that was based on actual census data and travel survey data from both Switzerland and the Netherlands. We created a spatial context model and then combined that with the air pollution maps we created earlier. And these were all hourly maps. So in the end, we got then a simulated personal exposure for all sorts of different profiles. And this is just an example of what these profiles could look like. So here, for example, we show you 2 female profiles of high SES, 30 to 65. One is a worker, one is a homemaker, and we had a couple of those different profiles, which gave us different exposures. I think that was my next slide. Yes. Now, to evaluate how well these agent-based models worked, we actually did some actual measurements in Switzerland and the Netherlands. So we did tracking campaigns, and this is what we actually, our cohort, we recruited about 500 people in Switzerland and about 200 in the Netherlands. In Switzerland, we recruited from an existing COFCO Basel cohort that was mainly around Basel. In the Netherlands, we spread out a little bit further. We recruited from the whole of the Netherlands, but you can also see that you know, there is some bias because we are overrepresented in the, of course, in the higher income and also in higher education level. And what we did with these people, we gave them a tracking device. So this was a tracking device which sampled every 20 seconds their GPS location when they were active, and then when they were stationary, it turned to it every 5 minutes to save some battery life. And we asked them to bring that with them for 2 weeks. We also had a phone app, and that was mainly used for time activity diary. So every day these people were asked to fill in their time activity diary. But in the end, we were also able to get some GPS location data from that, albeit on a 3 to 4 minute sampling rate. And you can see the difference on the right there. You see a similar, well, actually it was me cycling to work. And you see a Sodak tracker. The red dots, you see a lot more points, of course, because I got a higher sampling rate. But even the phone app did a pretty good job in following me through Basel. And the other figure shows you what we extracted from the time activity diary, and we had that for every person over a 2-week period. And so this is just showing you what data we collected in the Swiss tracking campaign. Of course, people in Basel travel all over, so not surprising that they go all over Switzerland, but also in Basel, we collected a lot of points and we're able to map that, of course. So let's go to some results. So we compared the exposures itself. And you see here the relationship between exposures for Swiss and the Netherlands. So Switzerland is on the left, and then the Netherlands for NO2, and then you have PM2.5 against Switzerland and the Netherlands. And you see between tracking data, so based on the GPS data, we compared that to what we got from the agent-based modeling, and then we also compared that to if we just took the residential location. And you see that all these comparisons actually are pretty nice. You know, we got some high correlations there. So that was good. That was our first. And then we applied these exposures again, both on, we now just use the ABM exposures, of course, because we don't have tracking data for our full cohort across the Netherlands and Switzerland. We applied that now to these two, in this case, 2 different cohorts. This was already published now in Environment International just a couple of weeks ago. And what we found, that we found very high correlation between mobility integrated, so this ABM estimate, and the residential exposure for both pollutants, for both cohorts. We only found very small differences in effect estimates between the residential and the mobility enhanced exposure. So these findings, we suggest that, you know, they support that assessment of long-term air pollution exposure at the residential address only, may not lead to substantial bias and loss of precision in health effects. And this just shows you actually in a graph. This is just the Swiss national cohort. And you see here the hazard ratios per 8th quartile range. On the left, you see NO2, on the right, PM2.5, and we did that for natural mortality and CVD mortality. And can see again that the home and the mobility enhanced effect estimates are, you know, pretty similar. They don't change that much, both for natural mortality and CVD mortality. So what we found is, well, first, just think about tracking campaigns. We actually found that we didn't really need that really fine 20-second GPS tracking device. When we looked at the mobile phone data, that was actually pretty good already to just follow people around, even with a 3 to 4 minute rate. Next, we found, of course, a very high correlation between tracking campaign and ABM exposure. So that gave us confidence that this ABM exposure was doing actually a pretty decent job in predicting exposures. Then we found the correlations. Let's see, where are we now? Correlations between residential and mobility and enhanced exposures also very high. And so when we feed that into Sapaldia, so that was the other cohort we used, I didn't present that, and SNC and EPIC-NL, So we didn't really find any differences, major difference in health effect estimates between the residential only and the mobility enhanced exposures. So our results suggest that by not including mobility and work location exposure assessment does not lead to substantial bias in long-term air pollution and health studies. So that's good news for, you know, a lot of the previous studies we've of course done. So we can sort of breathe better. And I want to thank the whole team who worked on this, so from Swiss Tropical Public Health Institute, from the Institute of Risk Assessment Sciences, and also faculty of geosciences in the Netherlands. And of course, I want to thank HI for giving us the opportunity to present this work with you. So thank you very much.
Thank you, Keys. We have one more speaker this afternoon. That's my colleague, Jana Milford from University of Colorado at Boulder. Jana will synthesize the review committee's findings and summary of these studies, and then we'll have maybe 15 minutes for question and answers.
All right, we're up there. So thank you all for your attention, and thank you especially to the panelists. I am pleased to be representing the review panel for this set of studies, and I want to first acknowledge the other members of the review panel. This was an enormous privilege for me to work with this group of reviewers, and I think our investigators will acknowledge that they did a very thorough job. Yep, okay. And I also want to acknowledge the HEI staff who are really integral to this process, both in supporting the investigators in their work, but also in supporting the review panel as we're conducting our reviews. So thank you to all the HEI staff, many of whom are here right now. John went over the aims of the RFA, so I will kind of skip this, but just emphasizing the focus on long-term exposure and on the suite of pollutants that are expected to be sharply variable at the interurban scale. So those were kind of the aims of the RFA. And in that regard, a number of features of the body of studies that we reviewed are really notable. First, good coverage of a range of pollutants. I think we especially appreciated the focus on ultrafine particles that was part of several of the studies. Very wide range of exposure metrics, from personal exposure to outdoor generated pollution to residential exposure, but adjusted for time activity patterns. A wide variety of exposure estimation approaches, drawing on mobile monitoring data, stationary data, low-cost sensors, satellites, dispersion modeling, a large range of techniques. The investigators all did an excellent job of both leveraging existing data that came into the study for them to use, but also doing new data collection. And we really appreciated that. I think you get a flavor for the high value that HEI gets from its investments in these studies when you see all of the results and all of the work that's been accomplished. There were a variety of health outcomes and health cohorts covered, and then both testing in sort of real world epidemiology studies, but also using simulations to garner more insights. So those were across the study some of the features that we really appreciated. So kind of taking them individually, I'm just going to hit a few highlights. There's a lot of words up there to sort of summarize key aspects of each of these studies. But for Leanne's study with her colleagues, we really appreciated the combination of mobile and fixed site monitoring, and especially the very systematic evaluation they did of sampling designs. And also particularly appreciated their analysis and their information they presented on the cost of those different sampling designs and the cost versus performance trade-off. With Scott Weichenfall's study that Marshall presented for us today, again, some really impressive mobile monitoring data that they drew on. That study featured investigation of both ultrafine particles count and size, so number and size. That was interesting. And then the contrast and comparison between the land use regression and the image-based machine learning models were really quite insightful, as Marshall covered. The study that Dimitris presented from Clay Katsiani's group was unique amongst the group that we looked at. Whoops. Thank you. Was unique amongst the group that we looked at in trying to tease out personal exposure to outdoor generated pollution. And we appreciated their drawing on existing personal exposure data and trying to estimate the contribution that outdoor pollution made to that. They also had some really insightful simulation studies to evaluate the influence of measurement error and measurement error correction techniques. So that was valuable. Gerard Hoch's study was the one that perhaps had the most systematic comparison of exposure estimation methods, including both mobile and stationary monitoring, low-cost sensors, and dispersion modeling as well. And that systematic assessment was really valuable in their approach. One other thing that was useful with them was their effort to come up with external validation data, in addition to looking at cross-validation and cross-comparisons between the different approaches. Having some independent validation data was a feature there. And then last but not least, the MOBI study that Keith presented was insightful, especially in presenting the comparison between the residential, just fixed residential, and then mobility enhanced exposure approaches, their development of agent-based models to look at the time activity and mobility information, and then the comparison of the GPS and phone-based tracking apps. All of those were important features. So John mentioned at the outset that we did very much appreciate all of the work that the investigators did to overcome the obstacles that COVID provided kind of early on in their studies, and impressive results notwithstanding those challenges. There were some other challenges that were kind of in common across the different studies, and maybe these are some lessons learned for us as a community and for future research. All of the studies would have benefited, all of the studies that looked at ultrafine particles would have benefited if we did in fact have long-term regular routine monitoring for ultrafines. There were performance limitations with some of the low-cost sensor devices, so lessons learned for other researchers in that regard. With the efforts to develop personal exposure estimates, the short durations of those personal exposure studies and the low number of subjects and locations for both the personal exposure and some of the residential outdoor measurements were a bit of a limitation. Those are expensive measurements to do, and so that sort of small sample size is going to be an ongoing challenge. There were temporal mismatches between the health outcome data that the groups were using that could span as much as 20 years in some instances, and the effort that they were making in real time today to try to come up with exposure estimates. So the need to do backcasting or make assumptions that spatial patterns hadn't varied much over time was a limitation in common. And then always, I guess we have the question of generalizability of results. So there's a need for replication of some of these analyses in other locations to make sure that the findings are robust. Excuse me. So key findings and lessons learned, and I'll start with the exposure estimates. It was pretty much a common finding that the exposure estimates from different estimation methods were well correlated, but they had larger differences in the absolute values across the different approaches. So that was a fairly consistent finding. We were perhaps a little bit surprised, maybe others wouldn't be, that the machine learning and more established land use regression modeling approaches performed pretty similarly. I think maybe in part because there were extensive land use data available for most of the LUR efforts here. Marshall talked about that a little bit in the context of the CNN work that they did. Leanne highlighted the real importance of balanced sampling. So if you're trying to save money, reduce the number of samples overall, but make sure that you've still got balanced sampling in terms of time of day, day of week, and season of the year. Estimating long-term personal exposure to outdoor generated air pollution may be the silver or gold standard, but it still remains quite a challenge. I think that's fair to say. Because it's expensive to do that, you're going to inevitably have small data sets, question about whether the study subjects in those personal exposure monitoring campaigns are representative of the broader cohort, and the estimation of infiltration factors, how much outdoor pollution penetrates indoors is an issue. And then we found that the use of simulated health association studies was really valuable for assessing the influence of exposure errors and also testing out methods to correct for those errors. Turning now to more the epidemiology analysis, the alternative exposure estimates generally didn't change the direction. I keep forgetting to change my slides, but John's good at pointing. Thank you. We didn't see a change in the qualitative results. The directional change, the direction was the same, but there were changes in the magnitudes of the health associations and also the size of the confidence intervals. So improved exposure matters, but maybe it's not leading us too far astray in terms of direction. And then the other thing that's really important to note and to highlight is that the measurement errors generally led to underestimation of the associations. So if anything, we're underestimating our expected risks and associations with health effects. The health associations were similar for the residential and mobility adjusted exposure estimates, and the MOBI study in particular highlighted that it looks like it's okay to be using residential exposures. Again, that's a result that probably needs to be replicated for other situations and locations. Error corrections are useful if the errors can in fact be reliably estimated for a particular study. So using methods like SIMX or regression correlation can be beneficial. And that was a particular feature of Clay Katsayani's work. And then I kind of hit this already, but really further research is needed to develop representative validation data, both for personal exposure to outdoor generated pollution, but also external validation data for just residential locations themselves. I think all of the studies were kind of limited just because there wasn't enough money to do that all as well as might have liked to do. All right, so the last thing I have is a homework assignment for all of you. All right. We have an outstanding body of 5 HEI reports that are coming from this set of studies. The first 3 of them, I understand that Katsuyani study is just up on the website as of this week. These are detailed, comprehensive studies that are really valuable because they cover the whole study. Some of these studies had 10 or 12 different publications resulting, but it's really nice to see the whole study put together comprehensively and get to really mine it for all of the richness that it deserves. So you all please take advantage of those reports that are up on the website and dig in. All right, there's lots there to investigate and appreciate. So thank you all, and we're going to turn to questions. Okay. We've got our question.
Yeah, thank you for the wonderful presentations. I'm Jiaqun Zhang from the University of Southern California.
Let me, there we go. Okay, I wanted to make sure Marshall, that we're good.
Yeah, thank you. Yeah, I have 2 questions for the second presentation given by Keith. The first question is that I wanted to clarify the concentration maps that you used. Is that for ambient air pollutant concentrations, or could it be like further considering the difference between indoor versus outdoor? Like if I'm going to the office, the concentrations in the office might be different from the outdoor concentrations. And then the second question is about
Let's do one at a time.
Okay, sure.
All right. So you want to ask Keith to answer that?
I can very quickly answer that. These were outdoor air pollution concentrations, completely outdoor.
Got it. Yeah, thanks. And then the second question is, if you were to do this in another city, would you expect like similar outcome, like the mobility adjusted exposure be similar to residential based exposure?
Well, yeah, that's a good question. So we did it in the Netherlands and Switzerland.
Mm-hmm.
So there we're pretty confident that that is the case.
Mm-hmm.
Transferability is a bit depends on, you know, do people have the same behaviors? The concentration maps look similar. So definitely it is transferable to similar geographies, different demographics, etc. But you know, we cannot say that this also is true for, you know, say the States or somewhere in China or somewhere. So
Yeah.
it's true for where we studied it, but I think there's more potentially more work can be done to replicate that and to add evidence to that.
Sounds great. Thank you.
Harshit Gujral, PhD student from University of Toronto. My question is for Jana. In your presentation, you talked about model validation, specifically for the exposure data. I am wondering what kind of challenges were visible in all of these studies that the authors have encountered to validate the output of their model with the observed ambient data.
That question for me?
Yeah.
All right, so I'm having the same problem that Doug Doherty was having this morning. I cannot decipher the sound from that mic, so someone's going to have to help me out. Apologies. But I think it's something with that mic and hearing aids, maybe.
Questions. What challenges did the investigators encounter in validating their evidence?
Okay. Yeah. So thank you for that question, and I apologize that I couldn't decipher it. What we were referring to there with the external validation was that several of the studies tried to collect external validation data that would be held off independently from the data that were used to develop their models. And in many cases, really uniformly, I think the sample size was small for that external validation data set. Sometimes there were limitations because there were efforts to use less cost sensors or instruments that were not working perfectly throughout the setting. And then because these are long-term exposure estimates, it's just so challenging to take sort of short snapshots of external validation data and make an inference about a long-term exposure. So those were some of the things. And I think maybe some of the investigators might want to add to that question.
Yeah, it's a follow-up to what Kay said and you, Jana, said. So before our study, we did something similar to what Kay's presented. So we had the London Hybrid Exposure Model, which is a model that is based on typical time activities for thousands of Londoners. And then we applied that to epidemiological analysis, and we practically found no biases, no differences in the health effect estimates. So when we submitted that application for this project, we were not expecting to have such low correlations and so different results when you use real personal exposures compared to theoretical adjustments. So yeah, it was a surprise for us. And I do agree that we really need validation data sets to validate this agent-based modeling or our hybrid exposure model or any kind of direct or indirect adjustment for time activity.
Thank you.
Hi, Perry Heistad, Oregon State University. Amazing session. One thing that really jumped out to me was the high correlations across all of the studies looking at different ways of modeling and creating exposure surfaces versus the very low correlation between personal, measured, and outdoor. And so I would like to get everyone's thoughts on whether we're focusing on the wrong thing as an exposure field. We're sort of focused on creating exposure surfaces rather than maybe modeling infiltration or measuring indoor concentrations. And John, you'll probably have lots to say here. But just your thoughts on where we should focus if we really want to move towards personal exposure measures.
I can start if you want. We have discussed that extensively, haven't we, Ben? Yeah. So when you develop a model, you validate it against reference monitors. Reference monitors are usually placed in places based on convenience. So that might be one of the reasons. So they're not placed everywhere. People move around, move across places. You cannot have a monitor everywhere. So one reason might be that, the way that we validate our models against reference monitors. And then, of course, what you said, another reason is infiltration, how much of outdoor air pollution penetrates indoors. So ideally, I think the way forward is if we could have a good exposure model which can predict personal exposures from outdoor sources or from indoor sources and validate it with good performance measures. Yeah, and again, I think probably the difference is because of how we validate our models against reference monitors and not against personal exposures.
So our study, we didn't actually focus on those questions of personal exposure, but from other work we've done, I think it would be value added to separately model infiltration and to do a better job of personal activity, which I think the work that you actually presented yesterday, Perry, with relying on cell phone data has the potential to do that. I'm worried about the personal exposure studies that use simulated exposure because I think in an epi study that adds measurement error. But in other work we did much earlier for the Mesa Air study, we found that the uncertainty in additionally modeling infiltration on top of the exposure surface added more uncertainty to the exposure estimates and actually, I think, it added measurement error. And we haven't quantified that. We didn't do that in our study that I reported, but I think there's a lot more to be done there.
Just, Dimitris, correct me if I'm wrong, but I wanted to remind folks that one of the things you recommended was to have outdoor residential measurements to accompany your personal exposure, and you didn't have that for your study. So that made estimating infiltration all the more difficult. Yeah.
Yeah, and another comment about epi studies, from the measurement error literature that's led by Adam Spiro, there's this spatial compatibility assumption that's important, which is that the air pollution measurements are collected at locations that represent the residential locations of interest. And as what has been noted, that's often not correct. And so that's a challenge. In our study, I glossed over that, but our mobile monitoring study, we actually designed those locations to align with the cohort, but that is very uncommon.
Time for one more?
Okay, thanks.
One more.
One more. Meredith Franklin from University of Toronto. Actually, this is a nice follow-up to Leanne's comment. I was very curious about and struck by the impact of measurement error on the effect estimates that was less than the design. And I was curious if it had to do with temporal averaging, if that's what you think might be happening, or if there was some spatial misalignment where you saw that the design was more important than sort of the measurement error on the health effects estimates.
Well, in our study, the way we looked at that, I think it was the temporal averaging, and we tried to correct for that. We tried to use the kind of what's in the literature published for temporal correction, and that did not help.
Okay.
So we actually think, and I guess being a statistician, I have this bias, I'd rather rely on design than modeling.
Right.
So.
And do you think you'd see the same result if you had?
Again.
I'm sorry.
Marshall, thank you. All
You're welcome. Thank you all.
right, Dan.
Yeah, and I'll just say really quickly, there should be ice cream out there. It's time for the ice cream break. So go treat yourself. And then we have our final poster presentation, starts at 3:30, and then it's a free night. And then we'll start back up here in an open combined space again tomorrow morning. Thanks.
Thank you very much.
It's like everything.